There you go.
Mixed Miracles Radiothon continues with 94.9 Mix FM. Greg and Mare, and on the screen, because we're watching a Facebook Live video right now, Dr. Sean Elliott. Now, is that a real thing? Is that your real name?
That is a real thing, and I am a real doctor. I am not a basketball player.
You're not.
You've got to get that all the time, and I'm so sorry to start off this conversation that way. But, the great Sean Elliott played at U of A, he played at Cholla High School, he played for the Spurs in the NBA.
But he's no doctor. I'm sorry.
But he's no doctor. He's no doctor, Sean Elliott.
Yeah,
That's you with the bow tie.
There you go.
Cute bow tie. I love this look.
Thank you. This has become my signature look, and it started for a good medical reason, like not to drop neckties on patients and transmit stuff. But it's become a sort of a statement. So I get to wear fun, bright, bow ties, pediatric themes, you name it. And people know me as the bow tie guy.
Okay, I'm going to call you Dr. Bowtie. You're a pediatric infectious disease doctor. It makes sense why you're looking at the germs. Greg, this should be your BFF because he's always been kind of like a germaphobe, which is a good thing during a thing like COVID.
I'm just aware. I try to be aware. That's all, Dr. Sean.
That makes perfect sense. I'm with you on that. Good idea.
So are you kind of like the pediatric Dr. Fauci, if we had to simplify it for those of us in layman's terms?
Yeah, I think that's a fair assessment. I certainly am tracking and following the COVID response, both here at TMC as well as around the city and the state.
Tell us about what the kids that you've seen there at TMC for Children are experiencing when it comes to COVID. Are the symptoms pretty light? Are they in and out of the hospital pretty quick? How's that going?
Yeah, most of our kids, thank heavens, are very mildly sick. If they're coming in, it's because they have fevers and maybe are a bit dehydrated, or they need a little support breathing. Early on, we had some pretty sick kiddos, but fortunately that has tapered off a little bit. Now it's a come in for a little tank up and send them back home again.
And why do you think that has changed from being very sick to not as sick?
Well, a couple things. First of all, I think thankfully our patients are coming to medical attention earlier, so we're getting them plugged in with IV fluids or oxygen earlier. There are some who think that the virus itself is a little bit less nasty. I think that's not true, given what's happening in this country right now. So I think we're just getting enough kids that are coming into attention sooner.
Okay, well, that's good to know. I've seen on TV and stuff a bunch of people saying that there's after they're sick, there's these symptoms that are like that.
Same as MIS-C or multi-system inflammatory syndrome in children. You can see why we use the alphabet soup, MIS-C. Those are very sick patients. And these are kiddos that have had COVID-19, whether we know it or not, who then come to us with all sorts of fever and multi-organ disease. And we have to do a lot of special support for them to keep them going.
And there's good treatment for it? Is it a long-term issue?
Well, there is a treatment. It's actually several treatments. And they're certainly, they're going to be our chronic patients for some time because a lot of them are having heart issues even after the fact. So MIS-C is a big thing. That in pediatrics is our major badness, where in the adult population it's patients with severe respiratory or breathing failure.
Oh my gosh, I just think about it. We all have kids. Greg has, how old is Maddie now?
She's 13 now.
And I have a 9-year-old and an almost 3-year-old, and this terrifies me, I have to say.
Understood. Thankfully, this is still incredibly rare. Like the number of MIS-C cases in the United States is fewer than 500 compared to the million plus children that have been infected. But it's something that we need to be aware of. And when a patient comes in, we have a very strong awareness of looking for that in our patients.
And are there underlying issues that happened before? Like, are there kids who already have some problems where it hits them more? Or is this just regular kids?
I'm sorry to say these are previously healthy athletes and awesome students and kids who have not a care in the world. And then they get nailed with COVID. And many times they don't even know that they had COVID-19. It can be asymptomatic prior to the MIS-C. So it's really on us as healthcare providers to be aware of that illness and to look for it actively when those kiddos come to our attention.
What kind of symptoms should mom and dad be looking for then if the COVID is often somewhat asymptomatic in the children?
Right.
Other thing shows up. What are they seeing? What are you seeing?
Well, a lot of times it's persistent fever without a clear source. And that, of course, is a great reason for the children to come to medical attention. Like, hey, it's been 5 days of fever, and my child is still really symptomatic. Fevers are the big part. A lot of them are also having some breathing difficulties. Some of them have a rash. Some of them have red eyes and lesions or sores inside the mouth. But most often, it's just the persistence of the fever which brings them into our attention.
I don't know how you do this, Dr. Bowtie, because I just think like the, hand, foot, and mouth disease could look like that. There's all these other things. Mono, I know when I had mono, my fever would never go away. It was like months, it felt like. And so I have no idea how you do your job.
Well, one of the beautiful special things is the kids are such strong individuals, and I get positive moments every single day that I see children in the hospital or in the clinic. They just make me smile, and they heal really well. We just have to give them that chance. Okay. So it's really important to show them the support and some love, and then they come right back to us with paying that back in spades.
We appreciate your time today. A couple more quick questions before we let you get back to work.
Sure.
Since we're here working on behalf of TMC for Children and Children's Miracle Network at 623 Kids, your donation right now being triple matched when you call 623-5437. We know that there are vaccines coming, right, that have been worked on, but really they're not being tailored or tested yet for children. What do we need to know about the vaccines and kids and how things are going to play out as we go forward here?
Right. I think the big thing to know is that vaccines are coming. That the first product, the Pfizer product, which has just been approved by the FDA and is coming to us this coming next week, has already been tested in patients down to age 12. Those numbers are expected to be coming in by early spring. The other vaccine product, Moderna, which is expected to be FDA approved next week, similarly just started recruiting its own patients down to age 12. So not children, but it's really those adolescents and young adults that we really want to protect by vaccine. Every indication is that we will have vaccine safety studies and approval by the FDA before the school year of 2021. So that will be by this coming summer.
And vaccines, we feeling pretty good about them?
I hope I am, because I volunteered for the Moderna trial, and I'm pretty sure I got the vaccine. So, personal commitment to safety and science. I strongly feel it's a good vaccine product, and this is what we need to do. And the masking and continuing with, as horrible as it is, the social distancing. This is what we've got to do to get over this battle.
Okay, well, that's really good to know. With the doctor getting the test, we were talking about this. The people who do the trials, that's a really selfless act to go into a trial.
Yeah,
and
you put yourself into this thing that nobody knows how it's going to turn out.
So thank you.
Yeah.
You're welcome. I'd have a hard time recommending something that I'm not myself prepared to do. So that's how we do this.
Dr. Bowtie, all I want to do is go and see my parents. They live in another state, they're higher risk, they're older. And so this is such amazing news for people who all they want to do is see their family and hug their family.
Yes, agreed. We're getting there, folks. We got to keep doing the right thing.
So with Christmas coming up and the holidays, what should people be doing?
Still not doing that traveling. It is still way, way, way too dangerous out there. We're not even near the peak of cases after Thanksgiving, and it's horrible out there. So continuing to avoid the travel, continuing to wear the mask, continuing to show respect to our families and our elders, especially by not giving them the gift of COVID, give the gift of distance.
Staying away.
For some family, they'll appreciate that we're not coming to see them.
There are stories there, Greg.
Dr. Sean, you don't want to know. Dr. Sean Elliott in the Pediatric Department, Infectious Disease Specialist right here in Tucson. We've got our very own child Dr. Fauci here.
Oh my gosh.
We thank you so much for wearing the bow tie. Yeah.
I've never met you except for over, this Facebook stuff, but I love you. You're awesome.
Thank you so very, very much. It's an honor and pleasure to be here.
Thank you.